Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dislocations. Introduction. Dislocations are joint injuries that force the ends of your bones out of position. They can affect major joints such as the shoulders or small joints such as the joints in the fingers or toes. A dislocated joint is an emergency. If you have one, seek medical attention. Treatment depends on which joint you dislocate and the severity of the injury. This program explains dislocations in general. It covers symptoms and causes, as well as diagnosis and treatment. It also discusses how to prevent dislocations. This program, however, does not discuss dislocations involving the spine. Joints and dislocations. Our bones help us stand up straight, and our muscles help our bones to move together. Bones connect at the joints. The most obvious joints are the shoulders, elbows, wrists, hips, knees, ankles. We have joints between the different bones of our fingers and toes. We also have joints that allow our vertebrae to move. Vertebrae are the small bones of the spine or backbone. A material called cartilage covers the ends of the bones of a joint. There is a little bag containing a small amount of fluid called synovium between the two pieces of cartilage in a joint. The combination of cartilage and synovium allows for smooth, painless motion in any given joint. Dislocations are joint injuries that force the ends of your bones out of position. A dislocation happens when any of the bones in a particular joint slip out of their proper placement. You can dislocate your ankles, knees, shoulders, hips, elbows, jaw. You can also dislocate your finger and toe joints. Once dislocated, some joints are at a higher risk of becoming dislocated again, but most joints return to normal after proper treatment. Symptoms. A dislocated joint often is swollen and painful. The joint may also be discolored or bruised. You may not be able to move the affected joint, or it may be difficult to move. It may even look out of place or deformed. Sometimes a dislocated joint may also cause tingling or numbness near the injury. For example, if you dislocate your ankle, you may have tingling or numbness in your foot. A dislocated joint is an emergency. If you think you may have one, seek medical care right away.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Dislocations have many possible causes. Often, dislocations are caused by a fall or direct blow to a joint. Some people are at a greater risk of dislocations. This includes people who are born with looser ligaments that are more likely to be injured, are involved in a motor vehicle accident, experience a fall or are at risk for falls, have a history of joint dislocation, participate in sports. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. You may also be asked about what you were doing when your symptoms started, such as playing a sport. A physical exam will be performed. The affected joint will be examined. Sometimes the joint is visibly out of place or deformed. You may still need imaging tests to rule out any broken bones or other injuries. Imaging tests that may be done include X-rays, MRI. Treatment. Treatment depends on which joint you dislocate and the severity of the injury. It might include manipulations to reposition your bones, medicine, a splint or sling, rehabilitation, surgery. To reposition your bones, a healthcare provider may try some gentle maneuvers. Depending on the amount of pain and swelling you have, you may need a local or general anesthetic before the bones are moved back into place. Severe pain should improve after the bones are back in the correct position, but you may be given pain medicines or a muscle relaxant. When properly repositioned, a joint will usually function and move normally again in a few weeks. Until then, a sling or splint may be needed. A splint or sling can help prevent you from using the joint as it heals. The amount of time you wear the splint or sling depends on the affected joint and the severity of the injury. Once the sling or splint is removed, you may begin a rehabilitation program. This program will help you restore strength and range of motion of the affected joint. In some cases, surgery may be needed to treat a dislocation. This is often the case if the joint cannot be moved back into the correct position or if any blood vessels or nerves were damaged. Surgery may also be needed if a joint is repeatedly dislocated.
Prevention.
There are some steps you can take to prevent first-time dislocations or repeat dislocations. This section explains how you can prevent some dislocations from happening. Wearing protective gear during sports may help prevent dislocations. Protective gear can also help prevent other sports-related injuries. You should also take care to avoid falls by getting your eyes checked regularly, being aware of whether the medications you are taking could make you dizzy, keeping your home well lit, removing any tripping hazards, such as cords or rugs, from walking areas. Once you dislocate certain joints, such as a shoulder or kneecap, you are more likely to dislocate it again. Follow your healthcare provider's instructions and do the strength and stability exercises for your affected joint to prevent a recurrence.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dislocations are joint injuries that force the ends of your bones out of position. They can affect major joints such as the shoulders or small joints such as the joints in the fingers or toes. Often dislocations are caused by a fall or direct blow to a joint. Dislocated joints often are swollen, very painful, and visibly out of place. You may not be able to move them. A dislocated joint is an emergency. If you have one, seek medical attention. Treatment depends on which joint you dislocate and the severity of the injury. It might include manipulations to reposition your bones, medicine, a splint or sling, rehabilitation, surgery. Once dislocated, some joints are at a higher risk of becoming dislocated again, but most joints return to normal after proper treatment. Dislocations may be prevented by wearing protective gear when playing sports and avoiding falls. Thank you for using Explain.